Hello everyone, and welcome to this latest edition of ALNAP's Urban Webinar Series. I am really pleased to welcome you today. My name is Leah Campbell, and I'm a Senior Research Officer here at ALNAP. On the line today we have four different speakers who are going to share a presentation with us later on, and I'll get to introducing them in a moment, but collectively the five of us are calling in today from the UK, Lebanon, Niger, the Netherlands, and the Dominican Republic. So we're really coming to you from across the globe, and we're glad that so many of you are also joining us from wherever you are today. I wanted to start off by also figuring out a bit more about who we have in the room. I'll get to introducing, as I say, our speakers in a moment, but we're also going to launch a quick poll while you listen to my introductory ramblings. This is just to get a quick sense of your experience with urban issues. So it goes from being a complete urban newbie, not having previously done or thought much about urban contexts, all the way up to urban experts who basically should be speakers on this webinar. Also. So it's just a quick fun poll. Have a think and submit your responses, and then we'll get to the results in just a moment. So about the topic we have today, we have a two-pronged topic, choosing and defining urban areas for humanitarian response. And really this topic is about within the broader city, at some point or another, it's probable that quite a few of us as humanitarians will need to either do analysis or assessment or program at a smaller scale than the entire city to work in an area, a neighborhood, a settlement, some sort of geographically smaller area than a city. And when we're doing that, there are two somewhat technical but also somewhat philosophical questions that might come up for us. One is, amongst the entire city, which area should we focus on? Where are the vulnerabilities? Which area should we prioritize? And how do we do that in a way that is evidence-based and that doesn't get based on convenience, and that we really are confident in the decision that we make there. The second part of this is about, once we're there, how do we understand what the boundaries of that area might be? Are those administrative boundaries? Do we ask people's sense of neighborhood? What if there are differences in those things, and how does that get reconciled? So that's really the topic we're going to be dividing or diving into today. And really this isn't about the merits of an area-based approach. There are other resources for that. There's some great research done by Parker and Maynard, and then more recently Sitko and Sanderson. We've had a previous ALNAP urban webinar about this. Interaction held a great workshop earlier this summer, and this is now also part of the agenda, both of the Global Alliance for Urban Crises and also a new working group on settlements approaches under the Global Shelter Cluster, as well as new guidance material coming out from PCI. So there's lots of other work going on about area-based or settlements-based approaches. And that's not what we're tackling here. We're tackling these technical challenges about choosing and defining the area. So I'm going to take a quick look at our poll results now. It looks at quite a few of you, 40%, have had some urban experience, but not a huge amount. So we also have about 16% of you who are quite new to urban. We also have then 12% who've done some research on urban, but perhaps not operational, and a good number of you also have had a lot of operational experience, 33%. 0% of you said you're urban experts and demand to be added as a speaker on this webinar. So I'm glad we got it right, because we do have four very experienced experts in their own right to introduce to you in just a moment. I just want to quickly explain the outline of this webinar before we get to them. So as I mentioned, this webinar is quite a long one with four different speakers, and we're running for the next 2 hours. The webinar is going to be effectively split up into two halves. Within each half, we have two presentations and time for Q&A. We also have a couple of more polls to throw in for you throughout. So in the first hour, we have presentations from CRS and UN Habitat, and in the second hour, we have presentations from Impact Initiatives and Humanitarian OpenStreetMap. So without further ado, we're going to start our first section And we're going to introduce our first two speakers to you. And again, while I'm doing this, I'm going to launch another poll, just so we also hear a bit more again about your thoughts. The poll is about when you're thinking about what area to choose. There's two parts to this poll. You can answer all of the following, which might be applicable about when you might choose an area, just to give us a sense of when this might be an issue for you. Is it when you're doing an assessment or analysis? Is it in a humanitarian response? Would you be looking for one area? Would you be looking at multiple areas? Or can you not see any use at all for geographic areas? I apologize, there's only so many options we can put, and there's no option for a fill in the blanks. But you can always add in your own thoughts in the questions bar. So while you're filling this out, I will introduce our first two speakers. Our first speaker from CRS is Tullio Matteo, who is an architect with a master in urban development and post-conflict reconstruction. Before becoming part of the Global Technical Advisors, Tullio served for CRS's Typhoon Haiyan response in Tacloban in the Philippines, where he was responsible for the urban planning and disaster risk reduction activities. He's previously worked in diverse reconstruction projects for Entrepreneurs du Monde, Habitat for Humanity, Oxfam and UNICEF in Haiti, Dominican Republic, the Sahrawi refugee camps, and Rwanda. Our second speaker after Tullio is Riham from UN Habitat. Riham holds a bachelor's degree in landscape architecture and a master's in sociology from the American University of Beirut. She has worked as a landscape architect for engineering consultancy firms, an urban planner for UNDP, and is now the socio-urban coordinator for UN Habitat in Lebanon. Riham is particularly interested in social development and spatial analysis. In a moment, I'll turn over to Tullio. We'll just take a quick look at our poll here. So, 78% of you would potentially look at choosing a geographic area when you're doing an assessment or analysis, and 67% of you would also or instead use choosing an area for implementing a humanitarian response. 41% of you would use choosing an area to find one specific area, where 57% would look at finding multiple areas that might be compared, and none of you see no use for geographic areas, which is probably a good thing since you're going to spend 2 hours of your life with us here today. So thanks for those responses, and without further ado, I'm going to turn over to Tullio for our first presentation. Take it away, Tullio.
Hi everyone, I'm going to be presenting about our experience in the Philippines. The presentation has the reflection we've had from our emergency and transitional response, as well as the permanent long-term housing solutions that we are providing right now. So I would like to start with this picture because it tells us the story about many of the challenges that we face there in the Philippines. The no-build zone was an area that was identified by the government that was trying to be enforced after the typhoon, and that was also very crowded, especially in Tacloban. We had, of course, a lot of population with a diversity of needs and vulnerabilities. We also had limited spaces for building new housing solutions. We had, of course, people losing livelihoods, losing families, family members, and documents. But we also had a lot of opportunities. Other citizens, residents, willing to host their fellows, willing to repair their house in a much better way. And I would say that, very important, we had land available nearby in the city area, and then we also had a government that was trying to become the driving force, and because they had experienced themselves the damages of the typhoon. In CRS, we had two different strategies. We had the emergency and transitional response, which focused on 3,000 families, providing a set of options, 7 different options according to needs. And that was until the government could provide a permanent solution. And then on the other hand, or after that emergency and recovery response, we have the long-term one, which focus on another very vulnerable area. And the targeted 900 families to be relocated to a new resettlement with a community-driven approach. So what did we learn about this experience? How can we say that we chose areas and not by convenience? We can say that we had 6 different steps, and again, those steps apply for our emergency and long-term initiative. One of them is the mapping of the hazards, the mapping of the impact of the hazards. So first of all, either by doing it ourselves or through information available by other stakeholders, we need to understand the challenges that the area face. No, in this case, the height of the storm surge. We need to understand the height of the storm surge. We need to map the different vulnerabilities or the risks, like the height of the storm surge, floodable areas. But we also need to understand the non-physical vulnerabilities that can be the tenure situation, which is very critical in an urban area. We need to understand as well the aspects of livelihoods. And then we can start our process of, say, identifying areas based on actual needs. We also had a deep analysis or deep surveys to understand the population's actual needs. We needed to know what was the level of damage of the shelters, of course, but we also needed to understand, was that their priority? Would they prefer to have assistance, let's say, for food or for education or some other income generating support? We needed to understand that. And also we needed to have directions from the government. So we needed to see what was their vision. Do they have a master plan? Do they have a vision for their own city that we can, as we build our projects, we can build upon? And that's very important, as we will see, for our long-term or for either our exit strategy, but also for the long-term sustainability of our intervention. And then as we start getting out of that analysis, we need to start analyzing what options are feasible and are acceptable based on those needs and directed from the government. And I have to say that this is very important to get out of that convenience box. No, we need to identify not 1 or 2 solutions, but as many as we can to fit those diverse needs. And as we do that, we need to recognize, in the context of an urban area, that there are going to be, that these solutions might not be geographically linked to maybe the area that we are starting to consider. That people might choose solutions that are farther away or that we did not consider being. So we need to welcome those and start assessing the formal and informal networks that will arise. In the specific case of resettlement that we are doing at the moment, that could help us to have a more cohesive neighborhood approach or definition of a new neighborhood and make it more efficient in the long term as we start creating committees. And one thing that we discuss as well is the links that remain. So even if people are moving out, they still come back. They might still come back to their old area, residence area. So those things, we need to embrace them, those new connections, and use them to build that project. To wrap it up, I have to say that when we embrace that urban complexity and we follow these different steps, we were basically driven to address many different topics that maybe we were not considering at the very beginning, dealing with the politics and governance issues, dealing with urban planning, and maybe also we had to deal with infrastructure at a scale that we didn't consider before. No, of course, water and sanitation and DRR, but very, very critical as well was to explore with the government and the affected populations, how can we ensure the tenure, a safe tenure for them, so they can, recover the quality of life and be able to start generating income. As well, we had to facilitate a lot of protection and social activities to foster cohesion, and that is, of course, things that takes us out of the convenience box of that we might have in a single-oriented project. And we think that is very, very useful because in the end, it ensures a lot of buy-in by the different stakeholders, the population itself, but also by the government. We ensure that people are stable and they can remain safe and develop their life. And it drives all of us to coordinate better, to provide a holistic approach, to cover not only ourselves, but also with the own community, to cover as many needs as we can together. And then, of course, it connects with the long-term vision for the city and facilitates our exit strategy as international organizations, building towards a proper, a safe, durable, and sustainable intervention. And I think that was the synthesis of the 6 different steps and embracing the urban complexity that we had, and across the 2 different initiatives, the emergency and the permanent intervention. Thank you very much.
Great, thanks, Tulio. Before moving on to our next presenter, I wanted to remind everyone that you can send in your questions. You should have the functionality within your GoToWebinar dashboard there to send in any questions or thoughts, your own experiences, your own answers to these questions, and any follow-ups. Big or small, you're welcome to send in any of those questions throughout the presentations, and that way we'll have them on hand and ready to go once we start the Q&A in about 20-25 minutes. So before moving on to our speaker Riham from UN Habitat, I wanted to share a couple of other examples that came up during a piece of research that I'm currently doing here at ALNAP. One of these is vulnerability criteria for neighborhoods used by ACF, and these are based on the Sustainable Livelihoods Framework, and they're outlined in their document, Identification of Vulnerable People in Urban Environments, Assessment of Sustainable Livelihoods and Urban Vulnerabilities, which is one of the different tools that I've been looking at in a paper about tools for understanding urban contexts, which is what got me very interested in this topic. And I just wanted to add in a couple of the indicators and criteria that they developed for looking at different neighborhoods. In this tool, they've got housing with indicators including the distance from house to employment area, housing quality and consolidation, neighborhood development model. They've got access to urban services, including access to health, to passable road systems, electricity, and market access. They've got environment, including the situation, the topography, the access to groundwater, domestic waste landfill, and so on. And they've also got social and human capital, including location of neighborhoods where there are sustainable infrastructure or community services that are complex, the types of leadership in certain areas, literacy, urban violence, gated communities, and then any neighborhoods with certain minorities or certain populations in them. PCI, interestingly, also have a similar approach that they've used in a project that they've been doing in Guatemala, which I was in Guatemala over the last 2 weeks. I just got back a few days ago doing a case study for a further piece of research. And they use 18 different criteria to identify vulnerable neighborhoods in that project as well, including things like, have there been previous disasters there? Are there community groups or organizations present? What are the existing lines of communication between neighborhoods and municipal authorities? And proximity to physical hazards like rivers for flooding or slopes for risk of landslide. So there really are a range of different criteria that can be used. And those are just a couple more examples that I wanted to pull out in addition. So we're going to turn now to Riam to give her presentation from UN Habitat's perspective. Riam, take it away.
Hello everyone, I'm glad to join you today to share my experience in UN Habitat Lebanon. We've been part of an urban crisis response, as you might know, and part of our area-based approach, we've aimed to identify the most disadvantaged areas. Our aim was to ensure that the most disadvantaged population groups and geographic areas are identified. Subsequently, we aim to profile selected vulnerable urban neighborhoods which have poor socioeconomic status, refugee presence, or where there are stresses in basic urban services. By identifying these areas, we aim to gather more urban knowledge and create or pitch into the urban response for these vulnerable neighborhoods. So how did we do that? Our methodology or the selection process was designed to be participatory, using local knowledge, consensus building, and triangulation. And this is an ongoing process or exercise that we are on, and we've developed this methodology in partnership with UNICEF. So the aim was to identify the most disadvantaged areas across the country, verify them, rank them, before we get to identify the specific boundaries or specific neighborhoods that we aim to profile or that we aim to disseminate or let other agencies and stakeholders know about. In the first step, we wanted to identify these most disadvantaged areas across all the districts in Lebanon. So we involved and identified local stakeholders per district to be part of this exercise. These local stakeholders comprised of public officials, mayors from municipalities, civil society organizations, zonal units of focal point, for example, and so forth. We gathered these local stakeholders in workshops where they individually identified the most disadvantaged areas to them based on their local knowledge. Then we gave them some guiding questions and specific criteria to be able to rank their identified choices. And this selection criteria was comprised of factors such as the perception of poverty in this area, presence of refugee population, slums, out-of-school children, frequency of violence or insecurity, the overburdened public services, and in general to consider that these areas don't have more than 20,000 persons per area. After each of them individually identified and ranked their areas, they deconstructed their choices in terms of area choices and in terms of the rank they gave per area. So that was the local stakeholders' knowledge of the areas of the vulnerable areas which they govern. And the next step we wanted to, or currently, which is the step we are at, we aim at verifying this list by showing it or presenting it to national stakeholders which have knowledge about these areas of travel from a different perspective. These national stakeholders comprise of line ministries such as Ministry of Social Affairs, water establishment, education, regional offices, district positions, and infrastructure. If the verification process came up with a new areas to be identified or has certain remarks on listed areas, we would be consistent again with local stakeholders. And the third step, we aim at ranking the list of most disadvantaged areas. And how we will do that is that we will combine the local knowledge score that local stakeholders have provided with a multi-deprivation index score, which is at the cadastral level. And this multi-deprivation index would more or less be the objective score, and it would comprise of similarly several vulnerability indicators pertaining to education, such as out-of-school children and school attendance, child protection, child labor, child marriage, and child discipline, certain WASH indicators pertaining to sanitation facility usage and individuals who live within ITSs, other indicators related to health and nutrition, and social poverty or living under the poverty line. So in our ranking, we will be combining the local knowledge score with the multi-deprivation index score to get the average score of, or to be able to rank the list of the most disadvantaged areas. And the next step, and after identifying these areas, we will go ahead to identify these boundaries of the neighborhoods which we will work in. Given these informal, given usually vulnerable neighborhoods have informal boundaries, so we will have to delimit and verify the boundary of our studied area through discussing it with the municipality, through perception-based exercises with the community, or field visit observations. And all in all, as I mentioned before, these identified areas, we aim to further profile them through a neighborhood profiling, which is a spatial analysis tool that we use to learn more about and collect data about a certain neighborhood through pertaining to different sectors, such as the population, governance, safety and security, other social services, and basic urban services, and later on to develop response plans, also similarly within a participatory approach. Thank you.
Great, thanks very much, Riam, and thanks to everyone who's been busy sending in your questions. I'm going to take a quick look at those and start feeding some of these in. Before doing that, I just also wanted to share one more example of some of different criteria that could be used. IRC have developed a context analysis tool that they piloted in about 5 different locations. And this is another one of the tools that I've reviewed for the research I'm currently working on. And I put together this quick slide to highlight some of the things that came up both in their final guidance material and also some of the different pilots of different criteria that could be used to choose particular areas, in this case, to be looked at in more depth for the context analysis. So this includes the presence of a high number of IDPs living outside camps in the area. The IRC tool was developed for displacement contexts. Whether there were previous, existing, or future planned IRC programming in the area, any security risks or access issues for the area, and then particularly thinking about selecting multiple areas, getting variation, so you could have different representative examples of the city. Vulnerability of that area in comparison to other areas of the city, the organization's existing or future program or strategic preferences, existing gaps in contextual understanding, have assessments been conducted of some areas already, and also any request from government or other actors present to focus on a particular area might be something to consider. So those are quite a lot of examples. We had the 2 more in-depth cases from Riham and Tullio, as well as the few other examples I've brought in. And so we're going to start going to your questions. The first question that's come in is about getting into a bit more of the specifics of this. It's in part about how do we ensure that, I guess, an assessment when we look at a certain area is comprehensive. And then there are some specific subparts to this in terms of the technical details. is there a scoring system used? In Riham's presentation, you mentioned that a final score was calculated, but perhaps you could go into a bit more depth of how this is then used to choose one area, and Tullio, if you have any thoughts about how this was done there. The question, I think, is really about a bit more technical detail on, we've got these different indicators, they're used in these different ways. Then how do you compare one area against the next? How do you score them? Do you weight certain indicators or criteria? And overall, how is that done in a bit more depth? So we'll turn first to Tullio, because this wasn't covered in as much detail in your presentation, and then we'll go on to Riham as well.
In the case of Tacloban, I want to say that there were many different actors, no? Many different stakeholders, and it was important for us to first of all sit together and try to coordinate together with the government. That was very, very important. Then we also did the mapping itself of the city, or part of the city area, where we had unmanned aerial vehicles, no, drones, to be going around and help us out to start the assessment. Then we had teams in the field surveying, validating some of the visual data that we collected. And then, as I said before, we during the presentation, we had a process of individual household assessments that could help us segregate that data over the map. And that, I think, when we had that, we could see, okay, let's say these areas need more assistance on this, let's say, issue, and others on other time. And of course, once we had the let's say the surveys done by our field staff, we had a process of community validation. So we had community meetings where we, not only with the, let's say, the leaders of the community, but we called for all of the community to approach to us to these meetings, and or read the posting notes that we had posted in the neighborhoods, so they can provide feedback. And again, we needed to set up let's say, feedback mechanisms that would help us analyze, take those inputs and integrate them in our project.
Thanks for that that response. I'll turn as well to Riham to see if you have any additional thoughts about the specifics of how the scoring goes, whether you weight certain criteria, and perhaps what do you do when you have perhaps several areas that all meet the criteria? How do you choose then?
So the local stakeholders' knowledge of their areas varies depending on their experience, and given that we were covering the selection on a district level, so we would have different mayors from different municipalities, and definitely their knowledge varies. So usually we provided them with a specific criteria which can help guide their choices or guide their ranking. So that's on a local stakeholder level. Whereas in terms of the multi-deprivation index, as you could see probably in the table, we have different sectors, and each sector has its own indicators. And the percentages or the score of each indicator would eventually factor into the index of a certain cadastre. And that's how we would compare, that's why we aimed at comparing the local knowledge with the vulnerability index in general.
Great, thanks, Riham. Another question that I'm going to put to you both is, obviously in these two examples, you're both sharing what's happened in one particular context. And the question that's come in is about, is it possible to develop a consistent criteria that we could use across to measure the vulnerability level of an urban neighborhood, no matter the context, like we have, for example, for certain risk factors or certain sectors? Or is this something that's always going to be context-based, that each country and even perhaps each area of a country might need its own context specific criteria to use to measure. I'll turn first to Tullio to get your thoughts.
There is potential to have let's say, a basic criteria, but the analysis is really going to be context-based. It's impossible to have the same interpretation of an urban context in Latin America than in Asia or African cities. The people behave different, the expectations and needs are going to be different. So I think when we have a set of questions and like related to shelter, water and sanitations, those things can be standardized more or less, but then the analysis definitely has to be contextualized.
Great, thanks Tullio. And Riam, do you have any thoughts?
I actually second Tullio because the living conditions might be comparable between different areas or countries and the factors that feed into living conditions in a certain place. Nevertheless, every neighborhood or every area, slum, rural or urban area, ITS, etc., will have its own context and will have its own history and culture factors, urban services, etc., which have fed into the situation at hand. So definitely, there's a nuance in how we will be able to address a certain context versus another.
Great, thank you. We've had a few questions come in. I'm going to try and do my best to mold them together and to put the specific topic of this webinar spin on them. The questions that are coming in are about, I guess, the consequences or the implications of choosing one particular area for something when certain issues affect the wider city. As I mentioned, in this webinar, we're not focusing on the merits or the relevance of an area-based approach, but I think that there are some specific parts to this that we could look at in the context of choosing one area, particularly where we're talking about looking at different criteria for understanding which of those areas we should select. For example, there might be some topics that or challenges or issues that affect a wider area than just that neighborhood. And so how do we account for that when we're looking at, a risk factor or the situation of sewage or violence? Those might be things that are experienced across the city or across several areas of the city. And so how do you take that into account where there are things that affect a wider area than one neighborhood or one part of a neighborhood you're trying to look at? And how do you take that account within the approaches that you've tried, or how do you think others should account for that in future? And then what do you do about communicating that you've selected a certain area, particularly where other areas might have been involved in some sort of assessment? And are there any implications then of how you communicate the reasons behind choosing a specific area over another, given the fact that it's unlikely that just one neighborhood might be affected by any crisis, and you will be, in effect, making a selection. So I'll turn again first to Tullio to get your thoughts on those.
So in terms of the broader infrastructure constraints, I think that's extremely challenging, especially when we are not able to support the process ourselves. But that's part of the complexity of working in a city. And I think we need to take a leading role in facilitating conversations with service institutions or infrastructure agencies in the government, being able to join those conversations in maybe they have government working groups where we can drive or at least put our ideas there and get their buy-in as well. It takes a lot of time, and that might be challenges that we face with our donor commitments, no? But it's something that we cannot avoid. To build infrastructure also takes time. And then on how do we communicate the selection? So, of course, that starts since the very beginning when we are explaining we need to have a clear communication strategy. Since the very beginning, we need to think about it with our own team, with maybe with a focus group from the community to be able to have that communication strategy clear. Because when we communicate, we might have some setbacks. And then we need to be very open what we can provide or not. Maybe set up complementary support for those areas that might not be selected. We can include them in activities such as preparedness, hygiene that maybe are not so intensive as others, and that still improve the quality of life of those other neighborhoods.
Great, thanks, Tulio. And I'll turn again to Riham as well to see if you have any thoughts on this one.
Yes, so in our current methodology, we are identifying the most disadvantaged areas across Lebanon. And profiles that we've already, neighborhoods which we have already profiled previously, we used to select our neighborhoods based on our city profiles. So these neighborhoods would be within the cities we've profiled, and we would be able to usually identify the most vulnerable areas within a certain city. So this would give us the bigger picture or the context which our neighborhoods are within. In general, you were asking on how can we relate our problems that are within a certain area to problems that are at a more national basis. Definitely, whenever we're analyzing a certain area, we usually need to try to see the bigger picture. So, for example, if we're discussing basic urban services, we can't be analyzing or studying the network, the sewage network within the neighborhood without or suggesting to update it without learning more about the other networks that it's connected to, which are still undersized in surrounding neighborhoods. Or, for example, in terms of safety and security, too many times it's a crippling effect. So, if there's any incidents or insecurity within a certain city, it will also be replicated within the neighborhood. Similarly, livelihood opportunities or local economy, which is often integrated between one area and another. So, whenever even when we have an area-based approach, we need to keep in mind the wider context and the national factors that influence certain dynamics within a neighborhood itself.
Great, thank you. Tulio, I'm going to come to you with this one because I know you've done some work on disaster risk reduction. We have a question here about whether you think the approach to choosing an area would change or not in a preparedness program if you're looking at preparedness work rather than a response like the Taliban response that you described. Do you think the strategy of how you choose the area would change in a preparedness approach?
Yes, so I think it also depends on what you might want to achieve. But I would say yes, it can change. For instance, recently I was in Sierra Leone, and we wanted to. We are starting a project there that is to influence the government in this preparedness and mitigation works. And I think if we are trying to influence, we might want to be more conservative and ensure that we have, that we can show some success to then take the next step and go to more critical areas. So I would say that depending on what you want to achieve and the scope of your funding and your long-term vision, I think yes, we can adapt.
Great, thanks. And Riham, I'm going to pose another question to you. By all means, if you have any thoughts on the preparedness one, go ahead. But questions also come in that I think speaks to something that you were mentioning in terms of how UN Habitat's brought in the perspectives of local stakeholders in an area to help with choosing the area. The question is about how you deal with and negotiate between the priorities that local stakeholders might have and the experience and knowledge they might have with the experience and knowledge that the team might have with a specific topic. For example, there might be an aspect that locally people feel is important, but based on someone's specific knowledge about risk factors or about the response, they might think that another aspect should be prioritized. How do you negotiate between those aspects?
Probably this is why we wanted to develop guiding criteria for the local stakeholders, which would help deconflict their different opinions or any biases in their selection during the workshops, if that might answer your question. And similarly, that's why we wanted to triangulate the data with a multi-deprivation index, which is more of an objective ranking versus that subjective ranking that you gathered from the local stakeholders.
Great, thanks. We've had a few queries about whether we can share certain documents and methodologies. Some things are published, others are not. We do have UN Habitat have published several of their neighborhood and city profiles in Lebanon, so we can certainly make sure that we send out an email that has the links to all of those ones that have been published to everyone. A few of the other approaches that I mentioned, the ACF one is published, the PCI criteria haven't been published anywhere, but whatever we do have that's published, we will put together in an email afterwards and send out either right after the webinar the next few days, or when we send out the recording in a couple of weeks, depending on how long it takes to get everything together. And pending the speaker confirmation, yes, we'll make all the slides available. As well, there'll also be a recording of the webinar that you can watch back that has all the slides embedded in it, as well as a transcript. And those will be available in about 2 weeks after the webinar. So I'll probably go to our final question on this topic before we turn over to the next area of focus, which for me is an interesting one because some of you might know here at ALNAP I focus on urban and also coordination issues, and so I'm always interested when those two things collide like they do in this question. The question is, how do you coordinate with other organizations so that all the actors operating in a humanitarian response don't choose the same area for the same thing? I think this question is particularly a challenge when you are trying to use the criteria you've developed and you're trying to have a methodology, but those methodologies might be different than one another or the same, and then you come up with the list of the areas that are deemed the ones to focus on. And then at that point, after having gone through that process, might realize that others have the same idea. What do you do in that situation? And I'll turn first again to Leo.
That is a tough question, considering the multiplicity of actors and the rush that sometimes we have after a catastrophe to attend the needs. But I think what I've seen much more useful is that more often we see professionals willing to coordinate, or willing to sit with the others and talk, and that can come from headquarters and global shelter or different or WASH or markets discussions that are happening, and be able to, either in the field and top down, both have that interest to coordinate. Being able to join as soon as possible coordination boards that are in the area, either led by the government or by the UN system. I think that's key. And then, being able to negotiate, face the other organizations and not give them the back, and try to agree how to work in complement rather than against each other. I think that's the best way. And the negotiation skills is not only with the communities as we try to provide them assistance, it's also within ourselves as humanitarian stakeholders.
Great. And Riam, I'll turn to you as well, although I suspect part of your answer, because of the work I know that you guys have done at UN Habitat, working so closely with municipalities, my suspicion is that part of the answer for you is working closely with the municipalities so that they know all the things going on in their area. But I'll see if you have any further thoughts as well.
Yes, unfortunately in Lebanon we have a lack of data, so what we care to do with our urban profiling is to provide urban knowledge to whether local authorities or other agencies or other INGOs or NGOs working within the same vulnerable neighborhoods. So we care to disseminate and present our profiles usually within existing working groups or intersector agencies. Meetings. We similarly definitely make it available to the municipalities and create regional technical offices which can help disseminate this knowledge to any future stakeholders who care to develop any projects with the municipality. Similarly, after we usually profile our neighborhoods, within a participatory approach, we aim to involve all local stakeholders within a certain neighborhood to come together and strategize the projects based on the collected data together in terms of the response plan, in terms of priority, or in terms of dates or over the certain time frame. So in general, we care to disseminate this data. We think that it will inform or hopefully it will help inform other agencies' work. And similarly, we care to join forces on project planning.
Great, thanks Riam, and thanks again to both of you, both Tulio and Riam. Hopefully you'll stay with us for the rest of the webinar and maybe come back in the final Q&A section to add in further thoughts. We're going to start the second half of this webinar now, and shift a bit to thinking about once we've found an area to work in, however we decided it, how do we understand and I guess both make a choice about how to define for this moment the boundaries or the borders that we're talking about when we're talking about working in a specific area or doing an assessment or analysis of a specific area. I think some of the challenges about this is that these boundaries might be changing based on lived reality since they perhaps were originally drawn. They might not exist at all. There might be resistance to change in the boundaries because this might have certain political implications or could be contentious between different groups. The boundary might be at a higher level, a broader level than the area needed. It might be smaller than a city, but not as small as a neighborhood. And so what do you do there? Some of the common things that people seem to talk about are concepts around fuzzy boundaries, which is a way of demarcating an area without drawing strict lines and having more of a boundary area than a strict line. And also zones have been used, going back to the ACF example, they used some zones, and these have also been used as an approach in the city profiles that UN Habitat is doing in Syria, which are similar but quite different also than the profiles that the Riham talked about in Lebanon, where they've grouped together certain neighborhoods into a broader zone if they're facing common vulnerabilities and defined the boundary of that in that way. So that's a bit about this challenge, about identifying the boundaries. And so I'm pleased to say we have two more speakers joining us who I'm going to introduce now to share some examples of how they've approached this part of the challenge. The first speaker is from Impact Initiatives. Christian is currently leading Impact's field mission in Niger, where he supervises an applied research project focusing on community area identification and data gathering in out-of-camp settings. Prior to this, he was the technical lead on implementing this project's first pilot in Mafraq in Jordan. Christian has been with Impact since August 2016, and he studied physics and philosophy in Munich and holds a master's degree in development studies from the Graduate Institute in Geneva. After Christian, we're going to hear from Paul. from Humanitarian OpenStreetMap team. Paul has worked in open data, participatory mapping, location-based services, and GIS for over 10 years. Paul has a master's in telematics from the University of Twente and has worked extensively with local communities, businesses, IGOs, NGOs, and government agencies in both Europe and Africa. And he's currently the Director of Community Programs for Humanitarian OpenStreetMap team. So I'm going to turn first to Christian to hear his presentation from Impact Initiatives.
Thank you, Leah. I hope you can all hear me. On behalf of Impact Initiatives, we're very, very pleased to present to everybody today. Thank you very much, Leah, and her team for inviting us. So in the next few minutes, I will present to you an approach to identifying areas, community areas, for response planning and aid delivery, and that we are actually currently piloting in various different crisis-affected urban areas around the globe. I will first outline the approach itself, talk about the lessons learned so far from our first 2 pilot rounds, and then present some key findings to illustrate the usefulness of this approach. So I will not lose much time on explaining the rationale of identifying community areas or areas of intervention for response planning, as I think these reflections have been sufficiently discussed in the first hour. But in order to understand our approach to identifying areas, it is important to underpin the rationale of our particular approach. So we at Impact Initiatives, we're seeking to find a way to most reliably identify humanitarian needs, but also pre-existing local capacities in out-of-camp settings. Meaning our approach to identifying areas is crucially based on the objective to find reliable information on the ground in such settings. So it kind of nurtures an evidence base that can then inform where and how to respond. So that kind of ties back into the first part of this webinar. So in fact, our area-based approach is twofold. First, we identify a community area, or area of knowledge, if you want so, as conceived by its very own inhabitants. And once we have this geographic entity, once we have that identified, we then seek to identify people that have the best knowledge about this area. And as visualized here on the slide, oh, there's been, yeah, all right. As visualized here on the slide on the right, we look for key informant networks in and across identified community areas. And through social network analysis, we're then trying to find the best connected and thereby possibly the most reliable key informants for each identified community area. But today's webinar focuses more on defining areas, so I will not go much further into social network analysis, but we'll concentrate really on how we identify these community areas. So based on this rationale, let me now show you how we identify community areas or areas of knowledge. So we use a very well-known qualitative research approach, focus group discussions. And adding to this, we add a mapping component, a participatory mapping component. So we're talking about mapping focus group discussions. Armed with maps and different zoom levels, color pens, a note taker, a facilitator, we go to communities and conduct MFGDs, mapping focus group discussions, with 5 to 10 community members, usually of the same sex and same population type. That means either host population or displaced population. And the first thing that we would do is to explain very well the rationale of our approach, so that MFGD participants know from the outset that we are trying to identify community areas in order to find the most informed community members for this area on topics related to service access, population characteristics, humanitarian needs. And this from the outset avoids that participants stick too much to official boundaries or scale up their understanding of community area too much. A small anecdote, during our first pilots in Jordan, our first MFGD rounds, we naively just introduced the question, what is your community area, or where does your community live? And knowing that the word community can have many different scales in Arabic and can very well, for example, refer to the community of fellow Muslims, one MFGD participant replied, well, his community area reaches from Istanbul to Mecca. So we learned from that. And what we then tried to do was introducing a map of the larger surroundings, and at first familiarizing participants with the map by pointing out main landmarks such as mosques, hospitals, schools, etc. And the key here really is that you describe very well on the map using the local names of streets and landmarks so that participants can really visualize the map. And what we found is that most participants can then usually very fast orient themselves on a map. And then what we would then do, we would ask some first probing questions. So for example, where do you access daily services? Where do you go to the barber? Where do you send your children to school? Where's your hospital? And then that leads already to asking for local names of areas around which their daily lives are centered. So by then we are usually already at the point where several neighborhood or area names have been dropped by the participants. And then we would ask for similarities and differences between these areas. So for example, are people who live in this part the same as people who live in that part? And answers could then range from yes, absolutely, a silly question, to no, on this side people are much richer, they send their children to private schools, and on that side people from a different ethnicity live there, and households are generally much poorer, and there's no interaction whatsoever between the two different populations. So in that sense, we try to establish similarities and differences between those different names, different areas that have been named. And then we want to know, where do these differences start? Yeah. So in order to delineate areas with certain characteristics. And sometimes there's obviously some sort of continuum between two areas, but very often what we found is that landmarks, hospitals, schools, police stations, and so on, or certain infrastructures, mostly main streets, or geographic boundaries such as hills, ditches, riverbeds, that they mark a clear boundary between such areas. And these boundaries are usually also conceived as boundaries by local inhabitants. And in so proceeding, we usually do several MFGDs per locality. And then we usually see some sort of data saturation. So that means we always come out with the same boundaries that have been drawn, with the same area names that are used by different focus group discussion participants. And then based on this data, we're able to draw a city map with different community areas, community boundaries, disposing of a certain profile, certain characteristics for each of these boundaries. And such common characteristics that we find usually are more or less same livelihood and income, more or less similar population density, tribal origin or ethnicities, same employment patterns or economic activities in one area, and all of these commonly shared characteristics then usually define one area. So on the next slide, you see our results from our very first pilot that has been conducted in Mafraq city in the north of Jordan. And on the left you see official neighborhood boundaries, and on the right you see our results, sort of the endogenously identified community areas. And you see that there's quite a difference between the two. And the differences in Mafraq city are mostly that official boundaries, they span over uninhabited areas that weren't mentioned as a particular community area to us. Official boundaries mostly on the periphery, as you can see in the southwest of Mafraq, they don't include newer settlements that have been installed outside the initial city boundaries. And in the case of Mafraq city, it's also a very interesting one. Names often change entirely, like official neighborhood names have nothing to do with the community names, with the names used by community members for a specific area. And in one case, it was even the case that an official neighborhood name referred to an entirely different area than the community area that was known under the same name. You can see an overlay of these two areas. Here we have in white the official boundaries, official neighborhood boundaries, and with the gray lines we have the community boundaries as we identified them, together with MFGD participants. And you see that, while in some cases there's some overlap, especially if you look in the northeast, especially at the periphery, official neighborhood boundaries correspond to our boundaries, or the boundaries that we identified as community area boundaries. But globally, there is not too much overlap. What you see often, however, is that main roads, they do coincide, and they usually have official boundaries overlapping with perceived community area boundaries. But other than that, what we found from Mafraq City is that community areas are quite different from the official neighborhood boundaries. And to end this presentation, I will show you our latest findings from a similar pilot that we have been conducting in Difa in the east of Niger. It's quite a different context than Mafraq, because in Difa you don't really have official neighborhoods as such. There are official neighborhood names, but no one can really pin them down. There's no official boundaries for the official neighborhoods. We're talking about 6 official neighborhood names, and we identified 10 community areas, as you can see on this map. Again, main roads, geographic patterns, infrastructure, very much served as delimiting factors for community areas. So I don't want to go too much over time, so I think I'll leave it at that, and very happy to answer any questions about this approach.
Great, thanks so much, Christian, and I'm happy to say we are perfectly on time, so there will definitely be room for lots of questions. And that's another plug and reminder for everyone to send in those questions. I'm sure you were enthralled by Christian's presentation, but do take a moment to type in those questions so we've got them at the ready. I'm going to use and abuse my power as chair again to insert some more reflections from some of the research I've been doing as well before we turn to hear our final presentation from Paul. Again, for this this piece of work that I'm doing that'll be out around February about tools that humanitarians can use to understand urban contexts, I've come across different approaches to understanding these kind of boundaries, and it's interesting in Christian's presentation the approach of the focus group discussions hits across a couple of these. One is administrative boundaries. So this is the already existing boundaries, which I think can be quite useful, particularly where you're looking to compare the current situation to any baseline data that is available. And also, if you want to focus on a smaller area within a city without necessarily looking at doing analysis or programming in a holistic way, and you're just quite happy to just have a smaller defined boundary, and it's not as important to understand how that area is currently used. I think it's also useful to use an administrative boundary approach because these are boundaries already being used perhaps by local governance and in planning. And so if you use these boundaries or can incorporate them, your work can build upon the work being done by local authorities and planning departments, as well as the bonus of the fact that these boundaries are hopefully in many cases already defined and therefore no work further is needed. The challenge is, as we've heard even from Riam's presentation earlier, is that in some areas these boundaries might not exist. And as clearly shown in Christian's example, and in another example I'm going to bring in at the end of our session today, the administrative boundaries might not align very well with current use and understanding of the area, which brings us into the second potential way or approach to understand boundaries, which is kind of more a perception. How do we understand this area, this potential neighborhood? The advantages, I think, of this approach is that you can get a real understanding of the current use by residents, and this can also often include a participatory approach, as Christian's example has shown. It might also shed light on other dynamics, for example, how different groups understand the same area. And it might be the foundation for further participatory activity, and is particularly useful and needed in the case where there aren't any official boundaries to go on. The challenge here is that no two people have the same understanding, and so some triangulation or data saturation, as Christian described it, will be required, and not everyone might agree. It might be hard to compare with baseline data because of not overlapping with boundaries that have been previously defined. And there'll be some need to carry out a process to gather and compare perceptions, because this social perception of a community or neighborhood area won't already exist. And also it's possible that those living on the margins who aren't part of a cohesive neighborhood might end up being left out. Another approach is to use a service catchment area, focusing on a specific service, for example, a school or a hospital, and the area served around it. So this is kind of using a core geographic feature and then looking at the periphery around it, which makes up a catchment area, which can be useful when looking at specific sectors, or if you're seeking an understanding of how people are connected to different spaces or different neighborhoods or communities. It can be particularly good to understand the connections between different boundaries. The challenge might be, again, that these might not align with administrative boundaries or social perceptions, and that catchment areas might serve multiple neighborhoods, but it's another interesting layer that might be looked at. Another approach, which Christian also mentioned was part of the mapping focus group discussion approach, is to use physical characteristics, satellite imagery, maps. So to demarcate an area based on a map or physical characteristics that don't necessarily align with existing boundaries but seem to make sense when you look at the physical structure, the infrastructure of the area, which again can be useful when there are no existing boundaries. It also could be useful because this might be done quickly, particularly where there is a map or a satellite image available. The negative side of this might be, or the challenge might be, that, again, this will not likely align to any current or past understanding or use of the area without further combination of this with other factors, and others might disagree with the approach. And you might unwittingly exacerbate tensions. So these are just some of the potential ways, and I think, as Christian's example showed, that often the approach might be to combine a number of these different approaches. Whichever the approach, there are some questions that you might consider. These include, what's the purpose of defining this boundary? What information already exists about boundaries and baselines in this area? How much time do you have? How precise do the boundaries need to be? Could you do fuzzy boundaries? And what extent are boundaries shaped by political issues, political affiliation, and how might this shape how you make decisions about boundaries? So those are just a few thoughts from me and the research. And now I'm going to turn to Paul for our final presentation before we start the Q&A.
So yeah, thanks Leah for the introduction and all the ideas just now. I do feel somewhat like I'm doubling up some information here and there. From our perspective, we're an organization, humanitarian OpenStreetMap team, that mostly focuses on, say, mapping of geographical infrastructure and features. So in that sense, we're often sticking to more the first category you indicated, the geographical administrative boundaries, let's say, and seeing how those match up to reality, community perception, and official administrative boundaries. And of course, there's several scenarios you can find there on the next slide. When you look at, say, more official administrative boundaries, which is the category we most often work with, as I said, the work we do is mostly in support of the programming of other organizations, in support of urban planning and disaster risk management. So in that sense, we often collaborate quite a bit with local, national governments to help them improve urban planning, service delivery of the areas they're governing. Of course, what you can find, the first case is the easy one, and the one probably not very often encountered by all of us in the areas we're working in. Everything aligns perfectly, all is neat and orderly, Basically, you can just use official data and be done with it. Of course, there's alternatives to this. Official data may be available but differ from community perceptions due to various factors as we just discussed. Social perceptions differ, service catchment areas are significantly different, or there may be physical characteristics which interfere. So there may be major roads or rivers crossing just through the middle of, say, official boundaries of locations. Fourth option is that there is a de facto understanding at the community level of boundaries, also of, say, maybe local government, municipalities, but a lack of properly surveyed data. And lastly, of course, there's also the option that there's little to no data on boundaries available, and you'll need to be working with local communities, governments to define those. Yeah, so this is the first case, roughly where I live. I don't think many of us will be working in this type of urban context, and as such, it's a scenario that I've actually not really encountered in the work we've been doing. Smack in the middle of the Netherlands, everything is nice, neat, ordered. You can get open data on boundaries, on buildings, and whatever infrastructure you need. If you would ever have an operation here, you're all set. That's probably not what you will be encountering. A major city where we have been doing mapping at the community level in support of urban planning is Dar es Salaam, which is a city which is, according to the African Development Bank reports, the fastest growing city in Africa, and growing at around 6% a year, which means about 500,000 people get added to the city on a yearly basis, which means that the situation is also quite dynamic, and community perceptions of boundaries also are a moving target. So you'll often be working with maybe official data, but that doesn't conform to reality anymore due to the growth of the city, in combination with urban planning, which is quite far behind reality. It's a city suffering from numerous issues, and due to that rapid growth, the project we're running there is focused on drainage and flooding issues, and say drainage waterways, and try to improve infrastructure to cope with that. A lot of associated problems there: floodplains being built up, waterways constricted, improper solid waste disposal. And what we found there is that there are official boundaries of the city, of the wards, but these don't really align anymore with reality on the ground as it is now. So indeed, here's the same type of approach that Christine was discussing for REACH, where you work with local communities and focus group discussions and see where, say, their perceptions of boundaries align with official government data and where they don't. This is important, obviously, because we've found, for example, cases where the local person in charge of a ward, which is the subdivision at which we're working in Dar es Salaam, had a very different perception of its boundary than the municipality, meaning that there was basically an area where no one was paying any attention to, because everyone thought it was being taken care of by someone else, which means these people don't have a voice, basically, have nowhere to address their issues and their living conditions to work on that. Here you see an exercise, by the way, focusing more on flooding and vulnerability, but in the same type of sessions we're also addressing administrative boundaries. There are official data sources available here. This is on the HDX, Humanitarian Data Exchange, where you'll find official boundaries at the ward level of Tanzania. But as you'll see, this particular one has quite a good shape. It's crossing major roads. There's disjointed pieces. It's incredibly large. If you imagine that the part just to the top right of it is all of downtown Dar es Salaam up until the, say, the inner ring road. But due to expansion of the city, as I mentioned, these type of things mean that there's by now a lot of people living in this area, and there's a very low level of awareness there of boundaries, whose responsibility these people are, and therefore whose responsibility it is to be making sure that services are properly being extended to the people living there. This is a bit of a different situation. This is in northern Uganda, around the refugee situation there. Of course, one of my smaller questions here is indeed how you define urban. There seems to be the USAID definition is anything above 5,000 persons or something like that, I believe. In a sense, the refugee camps in northern Uganda definitely count as urban, but it's a situation you encounter in other countries, and we've encountered in other countries and locations as well, where basically villages that have existed for some time are getting swallowed up by urban expansion, or in this case, expansion of refugee settlements, which means there's a very low level of organization and planning, and basically communities being swallowed up by larger ones, which really wreaks havoc on, say, existing perceptions of boundaries. So going back to the, say, the categories Leah identified, in this case, you're going to end up with a very dynamic situations where both service catchment areas and social perceptions, but also official boundaries are basically being pulled in a lot of different directions and will not correspond anymore to previous realities, which means there's a need to again be collecting more data and surveys and see how administrative boundaries will need to be handled to address current changing situations. Then lastly, we're also encountering situations where basically there's little to no information on the current administrative boundaries, which means that effectively a lot of people are not being accounted for in urban planning, in planning for education, healthcare, water points, those type of things. So what you'll see here is in Liberia, in Zouérou to be exact, city in more the hinterland of Liberia, where on the wall you'll see the latest and greatest urban planning documents that are being used there from before the civil war in Liberia, which basically captures just a tiny area of the city where people actually live, work, etc. And in this case, we've been working quite heavily with different layers of government, with municipality, with National Mapping Agency, LISTGIS, and everything in between, to work to redefine and standardize boundaries, and working with communities to get a sense of where indeed their perceptions of boundaries are, how that aligns to official data, which up to now just existed on paper. On the left you'll see basically the city's idea of what area they need to govern. There's 2 central blocks, and then in Liberia the official city limit is 8 miles, an 8 miles radius from the center of the city, so there's that. But within that there was very little idea on where communities actually exist, in this being quite dense jungle to a very large extent, tropical rainforests, with people living in places where they've basically not been counted and certainly not considered part of their administrative zone previously. You also see that the names given here are the very helpful zone 1 through 8, and within that there's named communities. The communities do have names that align to the names that the people living there actually use for these parts, and the zones do not. But that's also something you'll need to account for. So when figuring out the naming for these zones, you'll need to, or for the communities, you'll need to ask, what is the official name for this part if you know it? How do you call it? How do your neighbors call it? Do these things intersect, or do we need to make sure that we capture all these names? Wherever we can, as I said, we do try to collaborate with local authorities as much as we can. This also assures that, say, in future operations and interventions, other organizations can also make use of the same data. We're an organization that publishes all the data we collect onto OpenStreetMap, which is an open data platform, meaning everyone will have access to and can use that data going forward. This goes for both, say, local governments, but also other aid organizations. So hopefully this makes sure that in the future they will be better able to deliver services to everyone living in this area. Lastly, of course, we are collecting the data in, say, primarily digital format, but it is important also to definitely not neglect paper maps and make sure to, just due to the low possibility sometimes of having access to digital formats and the capability of people to be using proper GIS systems, do make sure to also be distributing paper maps and those type of things. That's it from my part. Next slide is thanks and goodbye. So yeah, looking forward to your questions on this. Thank you.
Great, thanks, Paul. Thanks very much. As the questions keep pouring in, I'm going to just add in one tiny final example that I came across that I think there's some method to my madness in why I'm going to tell you about an example from Boston in the US and a similar example in New York. When I was doing the research for the paper I've mentioned, I came across two blogs. One focused on Boston, the link is up there, and one DNA info looking at New York. Both of these examples have used open source software to crowdsource basically the type of thing that Christians mapping focus group discussions were doing. But on a crowdsourced kind of basis. So the idea was people living in New York or Boston could go in and draw the boundaries of how they understood their different neighborhoods. And I think the results are quite interesting in the context of thinking about this in a humanitarian context, partly because these are open source tools that any humanitarian organization could potentially adapt and use, and also because these issues around boundaries aren't just found in the context we've been talking about in the humanitarian world, but also in these cities. In the New York example, the blog describes how there aren't official boundaries and understood neighborhoods in New York. Boston does have official ones, and we'll get to that in a minute. But I just wanted to show a couple of the images from the Boston blog because I think they are quite interesting in the context of this discussion. So the picture that's on your screen right now is of one of the neighborhoods in Boston, and the different shaded colors show the percent agreement of what Christian was calling data saturation. So if more than 75% of people agreed on the area, it's the darker blue, and that's the kind of central area. And then you have more than 50% agreeing with a slightly larger area, and more or less than or 25% agreeing to the wider area there. And I think this is quite interesting. One of the quotes that this blog uses, I'm just going to read it verbatim because it really spoke to me. It says, "Although we talk a lot about boundaries, this blog included, the maps here should also remind us that neighborhoods are not defined by their edges, essentially what is outside the neighborhood, but rather by their contents. And it's not just a collection of roads and things you see on a map. It's also about shared history, activities, architecture, and culture." So while the neighborhood summaries above that they've used in this blog describe the edges on the maps, it's also interesting to think about the area represented by the shapes. Why are they the shapes that they are? What's the significance between difference of opinion between different residents in a neighborhood, people outside the neighborhood? The New York blog that you might take a look at has some interesting data on, for example, people who've lived in an area for more than 20 years. And people who've just arrived, which I think is an interesting reflection, thinking about displacement contexts where people who have recently arrived to an area might have a very different understanding of what they consider neighborhood to people who've been living there. And just to show you a similar example to Christians, this is a map on the left there of the neighborhoods identified through this Boston project, the darker blues being the cores with most agreement and the lighter blues getting less agreement as it goes. And on the right, that's compared with the official boundaries of Boston, which has a very similar finding as the focus group maps that Impact did, in that there's there's lots of difference there. There are some similarities, but there's lots of difference, and that's quite interesting to think about. And this kind of difference in shading, I think, is one example of the fuzzy boundaries I was talking about as one way of presenting this sort of disagreement. So we're going to jump into the Q&A now, and I'm going to ask the first question going back to Christian. Somebody's asked if you could give us a bit more information about who comes to the mapping focus group discussions, how those people are invited, how long it takes, and how you ensure that minority or invisible members of a community might get represented in these discussions. Unfortunately, right as I went to Christian, his internet has cut off. So we're going to come back to that question in a second and hope that his internet connection over there in Niger kicks back in. And we're going to go to Paul. Oh, and Paul has some thoughts about the original question for Christian. So we'll turn to Paul now.
So in our case, how we organize these focus group discussions, it's basically we try to approach it from different angles, and we do account for diversity there. So on the one hand, we will approach, say, community leaders and groups through local authorities. So ask them what the different, say, social groups, both in socio-ethnic and other types of identifiers are, and who to invite, who they think can be properly representing the group. On the other hand, we also ask them to keep, say, gender balance and those type of things in mind when inviting people to those focus group discussions. Then, of course, you also need to do your own research and see what organizations, for example, are based in a certain ward. So in one of the wards in Dar es Salaam, the Gambia, there is an albino association, which is quite a vulnerable group, a minority in Tanzania. So that's how we approach it, at least.
Great, thank you. Christian, I think, is just getting reconnected, so we'll ask another question of Paul and then get back to Christian when he's hopefully reconnected. Paul, there's been a couple of questions come in around data. How useful is it to rely on characteristics where there might be poor data? What do you do if data can't be readily verified? And I guess, how do you ensure the quality and I always have trouble with this word, representativeness, there we go, of the data that's used in the maps?
I mean, with respect to that, that does mean you need to have access to some data on inhabitants of an area. What is the distribution in age and economic type of activity, and poor versus rich, those type of data. So for that you want to look, and male versus female, etc. You want to see if there's any statistics available to make sure you're not excluding any socioeconomic ethnic groups that should be present and living in those communities. On the other hand, indeed, there's interviews with ward leaders and with others, so we try to take a look at different types of sources to make sure we have a sort of a good overview of the inhabitants and communities that are present in a location.
Great, thanks very much. And I'm hoping that Christian's back online, so I'm going to come back to him with the question of earlier and also another one. The first question, Christian, was about how you ensure that minority or invisible members in a community are represented in the focus group discussions, and if you could talk a bit about the process, how you select people for the focus group discussions overall, that would be interesting. And also another question's come in about how, when you're using these community-defined maps, how you then coordinate actions with local government who might have be using the administrative boundaries, and how you go back and forth between those. Okay, unfortunately, I don't think that Christian's internet connection has come back fully, so we'll cross our fingers and hope he returns and keep on going forward with another question for Paul. Paul, what would you say are the advantages and disadvantages of using open source tools for mapping?
The advantages, of course, are that the data you're generating can be useful to everyone everywhere. So as opposed to just generating data that's used for a specific use case, that's just scoped within your program, you immediately ensure that there's open, easy access to other people also to use the same type of data now into the future. On the tools that we're using, HOT has quite an extensive range of tools to support both the complete mapping workflow, but also access to information. So some of the tools we use most are also, say, standardized tools among humanitarian organizations. So there's, say, Open Data Kit, which is used quite widely for surveys at in a wide range of use cases. We've quite some expertise in using ODK, and there's a plugin on top of that, Open Map Kit, which is specifically geared towards gathering data for OpenStreetMap. So in that sense, it integrates quite easily with the tools other humanitarian organizations are already used to utilizing. I couldn't really think of any downsides to using open source tooling. In my view, there's only wins there. The only thing with regards to the data would be that you do need to be careful on the type of data you're exposing on certain, say, vulnerable groups. And there may be scenarios where there's definitely things that you need to be not concerned about, but keeping in mind on what type of data you can and cannot be opening up. So, but that comes before the pushing it out to OpenStreetMap.
Great, thanks, Paul. We're going to try third time's the charm, going back to Christian, on the two questions. The first one about how people are selected for the mapping focus group discussions, and then how to coordinate with government actors using perhaps official boundaries, administrative boundaries, rather than the ones identified in the focus group discussions. Christian, go ahead.
Thank you, Leah. I hardly understand you, but I have your question in writing. I hope you can understand me better than I do you. So coming back to the question that you asked about how to choose people to participate in MFGDs, how we chose them. Well, first of all, it's important again to keep in mind what our aim was. Our aim was really to define a geographic entity, an area of knowledge that we could then later use as a basis, as a unit, to gather information on, with the help of key informants, informed key informants within this community area, within this area of knowledge. That being said, we were still trying to be as sort of having as large of a spectrum represented in the focus group discussions as possible. In Jordan, for example, we always tried for each area that we targeted to have at least a female refugee, a female host, male refugee focus group. And indeed, perceptions, they did differ between these four different groups. One finding was that the refugee community, the displaced community in Mafraq, they always had a much smaller conception of the community area, which was probably a very contextual finding. It was probably a matter of interaction with other community members, being less integrated than the hosts that have been living there for generations. So hosts usually had a much bigger understanding of their community area than the displaced in the very same area. In the end, what counted for us was then really, as I said, to come up with a geographic entity, with a community area that was later understood by the key informants that we identified. So that was our main target, our main objective. So in that sense, our focus group discussions may have been in a way biased towards defining an area that can later serve as an entity, a unit of knowledge, an area of knowledge.
Great, thanks very much, Christian. The next question would be for both of you, both Paul and Christian. So we'll come to Paul first and then hopefully go back to Christian afterwards. And the question is about expectations. When you're doing the mapping focus group discussions, the mapping with communities, but you won't be the ones, you're not the organizations responsible for aid delivery. How do you manage expectations around that? So we'll turn to Paul first.
Can be a difficult one at times, but in general, we find that people are really happy to be part of the process, and that, of course, does mean that you need to make sure that there's not they're not overestimating what they're gonna get out of the mapping we do. But in general, we always include local communities and try to make sure we share back on our knowledge we gain and the data we generate. So what we find is that basically everywhere we go, people are already quite happy to have a proper paper map of their own area at the end of the process, which they can start using as a communication tool on the issues they're facing their communities, to local government, to higher levels of government, to other organizations. So basically we're also supplying them, what we're giving back to them is a bit of knowledge, so we try to include them in both the discussions, but if necessary, if we need to do mapping, we also include them in the mapping. We give them some training on how to be using tools, how to use a map, how to use data, and that already makes them feel, well, appreciated and accounted for as human beings living in those communities. So in general, they're already very grateful to be taking part in this exercise, to be part of the process, and also gain something from it in terms of knowledge. We often supply certificates, so they also have something to show for it in terms of skills they can utilize later on, and also prove that they've been taking part of this, and make sure they at least get some products out of the mapping and the process we're going through with them as well. We do make sure or make clear that we're not actually the ones that will be working on service delivery or aid operations in that area as well, but we do make sure that we supply them with something useful at the end of the process.
Great, thanks, Paul. And we'll turn also to Christian for his thoughts.
So I'm risking to repeat what Paul just said, as I can't really understand you. Manage expectations when doing mapping sessions, and when you're not responsible for aid delivery. That's a very good question, and I think it doesn't just relate to that mapping exercise. It's a question we always ask ourselves when doing assessments, when not doing delivering aid at first hand, but doing assessments. And especially in Jordan, during our first pilot, that was actually an issue. Especially in Jordan, in north of Jordan, you have a lot of assessment fatigue. There's been a lot of assessments that have been done that are still being done. So people risk having been interviewed for the fourth, the fifth time. So that definitely is a very big issue. And I think in the end, it is hard to address that issue, but one thing that you can do, that you should do, is being transparent. As transparent as you can be with the participants, explaining well what the purpose of this mapping focus group discussion is, and explaining very well what the objective of your project is. Nevertheless, that was definitely an issue we had in Jordan, and some of the participants that we initially identified, they didn't want to participate in the end because of exactly that issue. On the other hand, in DIFA, our second pilot, we experienced the exact opposite. People, they are very willing to participate in our focus group discussions, mapping focus group discussions. There's some feeling of empowerment. People really appreciate being asked about their local experience, about their sort of local communities. That hasn't been done before, and the feedback that we got from the participants in DIFA was a very positive one, particularly because of that feeling of empowerment. So I think to answer that question, I think it's highly context dependent as well.
Great, thanks, Christian. So I'm going to turn to all of our four speakers to just get any final thoughts and advice they would give to our audience today on either choosing or defining the areas when you're working in an area smaller than a city. But before I do that, in case some people have to head out to right at 4 and we run a couple of minutes over, I just want to say a huge thank you to all of our speakers for taking the time out of their busy days to share their experiences with us all today. I found it really interesting, and I'm really looking forward to listening to the recording and looking at the transcript as well, because there's been so much information. It's been hard to take it all in this 2 hours. So thank you so much, and also a huge thank you to the 50 of you listening out there still with us, who stuck with us over the 2 hours. This is the first 2-hour webinar ALNAP's done, and my colleagues weren't quite sure how it would go, so I'm glad that so many of you have stuck with us, and I hope it's been interesting. And a final reminder that a survey about your thoughts on the webinar will pop up and also be emailed to you tomorrow. If you could share your thoughts about what you thought about the webinar, we really value that feedback and do use it to inform future urban webinars. So before we end, I'll turn back to Tullio, one of our first hour speakers, to hear any final thoughts, advice that you might have for our audience as a closing thought.
Hi again. I think we've discussed a variety of cases, and I think all of them show the complexity and the need to have a multi-layered vision, no? And to be able to take things forward and address the needs. And then I think it was mentioned by Christine that we need to be transparent with when we intervene to be able to build this integrated approach. Otherwise, we will create ourselves some silos, and that's not what we really want. And then they need to mediate and negotiate with the variety of stakeholders that are in a city. So I think that would be my conclusion: having embracing complexity, being transparent, and be able to mediate and negotiate in order to succeed.
Great, thanks Tullio, and thanks also to Riam, who isn't able to join us for a final reflection, but thank you very much to you both for your presentations and for those thoughts. I'll turn to Christian for any final thoughts and advice for everyone today.
Thank you, Leah. Yeah, I think this whole session has shown across the 4 different presentations that we've heard and the discussions that we've had, I think it has shown that area-based approaches, there's still an immense potential behind that. There's still a lot of things that are not yet fully understood. The concept of community areas, where does a community area start, where does it end, what is the overlap between service areas, community areas, how do I get the best information within a community area, within a service area, how do I target these areas? So I think there's still a lot of work to be done. It was very interesting to see as well all these other different other approaches, and I think there's a lot of interlinkages there. We can think every one of us learn a lot from each other, and I think this is going to be a very hot topic for the next couple of years still. And yeah, for our part, we're very happy to share next year the final results of our 4 pilots. So we've been doing in the first 2 pilots, as we said already, and next year we're trying to come up with a final results report on our particular approach that I've been presenting.
Great, thanks Christian. And finally, I'll turn to Paul for any final thoughts and advice for our participants today.
Thanks, Leah, for organizing this webinar. I think it's a very important topic for everyone to be thinking about a bit more and take into account in our programs. There's also quite a lot that I think we need to think about a bit more how we can integrate it into our products. So, I mean, with the open data platform, OpenStreetMap, we're working on quite a bit. You're more or less contained to mapping or providing access to geographical features. So that means and things that have a geospatial equivalence that mostly pertains to administrative boundaries. But I think it's also quite important for us to think about how we can provide better access to These other types of boundaries we've been discussing, like social perception, service catchment area, service delivery, those type of features. So very helpful for me in that regard. And if anyone would like to speak to us more about how to be integrating the types of boundary mapping we've been doing, then I'd be happy to help there. So thank you.
Great, thanks, Paul. So thanks again to all of our speakers and to all of you. We will be, we have recorded this webinar. We will be getting a transcript of it and also an edited version into smaller clips so it's easier to share and watch again. And so all of that will be sent out to you in a couple of weeks, along with all the links that everyone's referred to and the presentations pending speaker agreement. So thank you all again. Please do fill out the survey and please do join us another time for another urban webinar. If you have any ideas, there's a question in the survey to let us know your future ideas and thoughts for future webinars. So thanks again very much, and I hope you enjoy the rest of your day.